Hello, welcome to another Dental Digital Marketing Conference Live 2020 session. I'm Dan Gemp. I'm the CEO of Dreamscape Marketing. And to start things off, thank you for joining us today. And a big thank you to my social practice, UltraDent, and Crown Counsel for having me today, as well as their continued support of the industry with events like this one. Today, I'm going to be covering an essential marketing voice, how dentistry let itself become non-essential, and the marketing messaging that will bring it back. My dental background actually began at birth. My mother is a dental hygienist her entire career, so I'm very familiar with the ability to understand somebody speaking with a toothbrush in their mouth. And more importantly, for the last 10 plus years, I've been building websites for dental practices and DSOs around the country, as well as managing their marketing and digital marketing campaigns. So what brings us here today, right? In this case, as the coronavirus pandemic moved across the United States, local governments drew the essential business dividing lines that literally left businesses and owners powerless overnight to control their own futures and protect their life's work. Unfortunately, dentists ended up on the wrong side of that dividing line. I believe it's critical to the future of dentistry that we understand how marketing at every level of dentistry, organizational, practice, and team, can help drive public perception and allow us to take control of our future. So today I want to discuss with you how dentistry let itself become non-essential. Okay, that's pretty insulting. And the marketing message and strategies that are going to bring it back. We will drill down to the root cause and extract the key message that will allow us to bridge the gap once we are Invisaligned in the communication that will get past the thin veneer of society's fears with bipartisan, bicuspid support. All things that should come naturally to you. So to understand where dentistry is now and how to move forward, we're going to examine the current perceptions of dentistry and why it wasn't considered essential by our leaders. The general awareness and pandemic messaging the dental industry should have had in place to achieve essential status and avoid government shutdowns, and the immediate practice level marketing that dentists can begin today to help their practices reopen strong and have a successful second half of 2020. So why wasn't the dental industry considered essential? I personally think you're all quite essential. The answer is that while you do a great job of practicing dentistry, we don't do such a great job of telling the public about it. And for the majority of the general public, their primary interaction, and sometimes only interaction with the dentist, is their twice-a-year cleaning and checkup. So it's fair to say that for the majority of the general public, their perception of dentistry, it's just a place you visit every 6 months to have your teeth cleaned, hardly essential. So right or wrong, fair or unfair, perception is reality, and marketing controls perception. In the dental community, we were well aware, are all aware of the serious health consequences of poor oral health. The mouth is a portal of entry for all kinds of infections and disease. Gum disease is the most common chronic inflammatory condition in the world. Poor oral health is linked to a host of illnesses, including heart disease, diabetes, respiratory illness, osteoporosis, rheumatoid arthritis, endocarditis, pregnancy, birth complications, pneumonia, infection. Okay? I know that 9 out of 10 dentists know all of this, but do 9 out of 10 Americans? That's my point today, right? When was the last time you heard dental health education content delivered in a public service announcement format to the public? Dentistry wasn't considered essential because the national messaging wasn't in place to guide the public perception that it was. Let's talk about awareness, messaging, and advocacy first, and then get down to the tactical, practical things that you can deploy today. So the Dairy Farmers of America, Cotton Incorporated, these are organizations that represent the interests of the members of an industry, regularly running public awareness style advertising campaigns. But why? They're not worried that I'm going to forget that milk is delicious and that t-shirts are comfortable. They're not alerting me to a particular single buying opportunity, and they don't directly benefit from the actions I take as a result of seeing their commercial for milk or cotton. So why do they spend immense time and huge budgets doing it? Well, simple answer. They understand the value of awareness. Humans in 2020 are bombarded with information, and due to guys like me, so much so that they have to make 35,000 decisions daily. If you repeatedly present a message to the public, it becomes ingrained, and that message goes into the collective consciousness to the point where we all accept it as fact. It lives in the background of our consciousness, just waiting to be called upon, as I'm about to do now. Got milk? And if so, does it do your body good? Is cotton, in fact, the fabric of your life? Probably not. But if I said that milk or cotton were key marketing campaigns, right? These are the slogans you'd repeat back to me when I ask you about them. So when I step in front of my bathroom mirror in the morning to brush my teeth, or even better, when I receive the "it's your time for hygiene" appointment text message or email, I'm confronted with a decision. Is this important enough to make time for right now? With only seconds to consider it, your messaging is already living there, waiting to be remembered. A healthy mouth is essential to my overall health. So how do we become more essential when we know that we are? There's no shortage of brilliant minds in dentistry. There's no shortage of organizations and platforms to support dental networking and education. Many of them are going to be speaking to you during DDMC. But a lot of these are internal facing, right? The missing component, as I see it, is an external one. Dentistry must craft and deliver a public facing message that conveys the value of regular hygiene to everyday people. And they do this by connecting it to serious health issues that are prevented by strong oral hygiene. This essential status messaging, right? This is a long-standing debate in dental marketing about how real to get with patients. The concern is that marketing around serious topics will be perceived as fear-mongering and scary upon public perception. And the public already fears dentists to a great degree, a bit irrational, but this fear often steers our marketing away from discussing the more serious health issues, which makes life easier, but removes a strong argument for essential status as a life-saving practice of medicine. So this is indeed a frustrating question to wrestle with. But what if we took the same set of facts and simply reversed the angle so that it is perceived more rationally? Instead of saying heart disease is a serious, potentially fatal medical condition that begins with poor dental hygiene, so see your dentist twice a year, instead of fear-mongering and scare tactics, let's try this. A quick 20-minute cleaning twice a year will protect you against all sorts of serious health issues. Friendly and easy to control the perception of that message. If the general public received regular messaging like that, then one, this would make and focus on the connection between regular hygiene and prevention of serious health issues. And two, it's going to shift the focus of the message from the severity of the illness to the ease of prevention. How easy is it to simply come in, get your teeth cleaned, and not have to deal with horrific health ramifications from not doing so? So it would create a dual purpose message that addresses our ability to market against those serious health issues, as well as validate regular dental hygiene as essential. And I'm not just talking about cleanings. So talking about the pandemic and recovery messaging directly. When faced with a crisis, doctors triage. That's what you do. We fix the problem right in front of us first, prevent the catastrophic result. To do this, we give up the capacity to step back and see the larger picture. So once you save the ship from going down, you have to tell the passengers it's safe to come out. In the months since the pandemic hit, I listened for such a message from dentistry, waiting for the field to take that final critical step of crafting a public awareness message that patient safety and best-in-class transmission prevention has always been commonplace, and especially now at the core of what we do. So where were the PSA ads? Every retail company from Chevrolet to Panera immediately got on television and told me that they had my back and that we're in this together. And most importantly, here is how I've made it safe for us to do business. So a little reality check on the beautifully crafted, heartfelt messages. They're marketing. Cars and soup and salad combos are certainly no more essential than healthcare. Even barbershops have recently received more press and more positive press, and they're driving a stronger case for being essential than the silence coming from dentistry, right? A gentleman who hasn't had a haircut in months and is growing a mullet is demanding that he's able to see the barber so he can go out and get a job. But why is that same gentleman not demanding a brighter smile for that same job interview? The truth is, we're in business to stay in business. This is a business. And while our humanity, caring, and drive is absolutely real, at the end of the day, if I don't make car payments to Chevy, they're going to take back that truck that they just gave me affordable payment options on. And Panera will feed me as long as my Apple Pay is connected. So the true and best messaging is always honest, as well as presenting a win-win proposition. We're mutually beneficial to each other. We need you to come back to survive. You want to come back for your health and normalcy. And to make that a reality, we've done everything we can to ensure you're safe in our care. Let's talk about advocacy. So all politics is local. Shutdown orders and essential statuses were ultimately made at the state and local government levels. Your governor, your county executives, those kind of groups. Advocacy groups must be in place, and regular lobbying efforts, even at the local level, must be maintained on a city and state level. And as I mentioned before, we shy away from the more serious dental health topics because we're wary of further stigmatizing a profession that they might already find a bit scary for whatever reason. I think it's just the noise the drill makes, but our lobbying efforts are not the time for this discretion, okay? You need to be deemed essential. In order to solidify the essential status of dentistry with our local leaders, we must draw the direct line between regular hygiene and serious disease prevention. This is the group that needs to be scared straight. Hit them with your worst horror stories, the grossest photos, the scariest statistics. Confront them with the serious public health threats that can arise without access to regular hygiene. Regular dental hygiene is a very acute example of preventative care in medicine. Where society accepts emergency cases as essential when it's too little too late, that could have been prevented in the first place. Do you want to die of a heart attack from an oral abscess? I don't. So parallels to essential services should be more prevalent. The impact of a good smile on mental health, on obtaining employment, on the interpersonal relationships in a limited social and dating scene in America right now. These are problems that you're contributing to the solutions for. So what should doctors and practices be doing right now? Okay. On a personal note, I would advise that you all sit down, carve out some quiet time, and just start a list. Nothing fancy. Open a Word doc, grab a legal pad. If you weren't in the midst of the greatest fight you've ever been in to save your business, what would you have done differently? Whether we've been seeing the worst of this current disaster or not, it won't be the last. And so having an established and organized set of thoughts is going to be tremendously helpful to you and to your marketing. So to the practice level marketing, the goal is now to establish normalcy. Hey, everybody, it's okay to come back. Just your neighborhood friendly dentist here. Reconnect with your patients and your staff, address their needs, and move forward. These are tactics that we're currently working on with our dental clients to address their needs and reopen strong. And much of this you can do yourselves. Internal messaging. You need to outline a reopening plan for internal use. A key audience is your team. They need to be saying the same thing consistently and feel confident in your plan to move forward. External messaging. Our practice is open and safe. There are not enough places that you could put that message. Remind people that dental practices already had transmission mitigation procedures in place. They were already safe places that were fighting infection. Demonstrate that you're executing a best-in-class, hygienic, and safe environment. New procedures to mitigate transmission, temperature taking at the door, expanded PPE, social distancing measures, reducing appointment capacity per day, and the concept of the parking lot waiting room. Those are pretty basic things that you could deploy immediately. Delivering the message. Okay, so a consistent and complete answer across all practice channels. That's how your marketing must work. Consistent, complete. Start with your website. Mobile first. More than 70% of your patients are engaging you through the mobile version of your site on your phone. I can't tell you how many dentists overlook this critical search engine ranking value, okay? Local search is dominant, mobile search is dominant, and it's a higher conversion percentage of people that engage you through their mobile devices. Your blog and your content. What a good time to produce content to put people at ease. After Google's May core algorithm update, this will help your site to rank higher. It will drive more traffic and inquiries, and you can publish your response and protocols for your approach to COVID. So it's a great time to add this content. This should cover practice updates, new operational and procedural explainers, specific topic advice, short, focused, keyword optimized advice, general oral health information, staff profiles, and how-to explainers. Job posts. You may be struggling with staffing issues from folks that don't intend to come back. Online business listings. It's time to update all of your external public-facing information on all of your channels that your practice maintains. Google My Business, I believe, is the most important. They've even added features where you can publish your COVID-19 expanded hours, protocols, and whatnot. Your social media, all of your patient-facing content should live here. Online reviews. My social practice would be the experts on that, but now is the key time to ask for reviews. Your patients are available. They may feel very important if you made special accommodations for their safety and their families. And these reviews are going to help you to boost your online reputation, improve your search rankings, increase your lead conversions. I mean, the list goes on. So let patients know at check-in, or if they're sitting in their cars waiting and they're long-running patients, that's the perfect thing to do while they're bored waiting. So simple, inexpensive ways to gain and garnish new reviews. Industry listings, just to make sure they're all accurate and all up to date. Now is not the time to miss a phone call. And getting an e-newsletter going, right? What a great opportunity to educate your patients, get a simple email campaign going, practice level public awareness. So what should be done on a national scale to be deemed essential can be done at a local scale to your own patient base, so that you return to a thriving environment and not a fearful patient base. Paid and organic SEO. Paid search is an opportunity to get immediate traction, and you may need that right now. And organic SEO and content generation would be a long-term strategy that you should consider as part of this new normal, even though I hate that term. Let's talk about the formats, right? What do things need to look like now that marketing can be produced on an iPhone and such? If a picture is worth 1,000 words, what is video worth? Video faithfully conveys tone and expression and creates personal connection. People are more willing to watch a video than read an article about it. It's informal, it's fast, it's evergreen content that has a good shelf life of years, and it's brand building, right? In dentistry, you can establish trust and it alleviates fear. It'll improve your rankings. Google does own YouTube, and you can transcribe those videos as simple articles for content marketing or emails. So the applications are endless, but I would recommend video first. You should all take a moment and plan out a video series and how you can educate people with video. A few examples: a reopening video. Walk people through your office, show them what to expect for the first visit back, make them feel comfortable, and this will diffuse a lot of apprehension. Basic dental advice and FAQs about transmissible diseases and the safety protocols you've been trained on. Patient testimonials, staff training videos, and staff profiles. Let people know who they'll be dealing with so they feel comfortable. Consider your business model and how digital marketing is going to help you evolve. So telehealth. This may just be a first point of contact or a triage mechanism, not an actual treatment mechanism, but it's remote, it's safe, it's quick, and it'll help you to prioritize the backlog of patient needs that you'll be experiencing very soon. Mobile dentistry or senior-only hours. Even Costco has senior-only hours, and you need to address this concern for demographics with greater health risks. Urgent care hours. Maybe that's not part of your business model, but people can't really go to emergency rooms right now. They're terrified of contracting COVID. So offer extended hours and emergency protocols to be an urgent care center for dental needs. It's a revenue driver. Direct sales of goods. Go e-tail with it, right? As simple as expanding your Facebook page to include marketplace and offering electric toothbrushes, water picks, etc. Just a way to make some money at a time when maybe that's tight. And shifting your payer mix, right? We got 40 million plus unemployed Americans right now. Insurance is going to be in upheaval. Their coverage is going to be changing. So you may need to consider cash pay procedural work, and you may need to consider in-house financing. You need to relaunch familiar, positive patient engagement campaigns. So a patient office contest, unmask your smile, a grand reopening, in-office social media, right? These are all opportunities to be fun, normal, engaging, but safe. And you need to do outreach to referral offices, business to business. You need to support each other based on insurances you do and don't take, specialties, machinery you may or may not have for certain procedural work. So send gifts to your partners, let them know you care, let them know you're connected, and let them know you're part of the community, because then maybe you can all advocate together to local leadership and become essential. So in closing, let me leave you with this. a term I have quickly grown to dislike, the new normal. This phrase and others like it paints a picture of an idyllic past that never really existed and a future that will not live up to our expectations. There will always be a new normal. So the truth is there's no such thing as constant normal. Life is not static, business is not static, and dentistry is not static. So think back to your practice 5 years ago, 10, 20 years ago. We don't have to go back very far before our thinking and processes are unrecognizable compared to today. My point being that sometimes we grow in tiny, imperceptible increments, and sometimes a dramatic global pandemic hurls us miles down the road overnight. But remember that change is the constant, not the variable, and it's nothing to fear. You simply need to market to the perception of that change. So yes, this time it was dramatic and sudden, and the time it's taking to recover has gone on longer than any of us are okay with or comfortable with. But we can and are catching up with this change, and you will too. Just before I began this talk, I Googled dentist, and the first pre-fill was near me, but the second was open. And that's what you are, and that's what you need to let people know. We're open, and it's safe to see your dentist. So in the aftermath of a crisis, we find purpose, personally, by playing a role in this recovery, right? Many companies, yours included, found their role being repurposing existing assets to fulfill a new need. Auto plants made ventilators, clothing companies made masks, distillers made hand sanitizer, just to name a few. But for our company, for digital marketing, we did not need to shift gears. As the pandemic moved across the US, business as usual ceased to exist. Digital channels is where everybody went for a lifeline. It's where they're doing their research, finding their medical resources. So it was clear that in digital marketing, right, the role as a connector between patient and provider would become more important. And that's where your focus needs to lie. That's where your market demand is. It's where your business opportunity is. So digital marketing is absolutely going to be helping dental practices to navigate and recover from this crisis, but it can also be intimidating, an intimidating world to work in, right? So even if it's your full-time job. So if you'd like to explore any of today's topics in greater depth, by all means, my team is available to help you and support you as part of the community. And with that, fight gingivitis, fight the good fight, and stay safe. Cheers.